So how do you know when back pain is really serious that we need to actually go to a specialist and we potentially need to have surgery? That's what we're going to talk about today. So first of all, the majority of back pain you do not need to have surgery for. I would say 80% of the people that have back pain should not have surgery. Probably 80% of the surgeries that happen shouldn't happen. And if you're having that generalized low back pain or the pain that goes into that hip, these are not serious things. These are not things that you need to worry about that, oh, I can't get resolution. If you get to the right person, you're going to be able to find a solution for that back pain, but it's getting to that right person. So even if you have pain that goes down into the leg and you have some numbness and tingling, these are not things that we worry about. These are things that can be completely resolved, especially if you can make your symptoms come and go, or I can move my numbness up the leg, or I can make it where I don't feel it and then it kind of comes back again. These are things that we call our mechanical issues. You're doing things throughout the day and that can make things better and make things worse. These are a really good sign that you do not need to have to go to having any kind of surgery or going into any kind of like surgeon to get this resolved, because these are some things that can be resolved if you can get to someone that understands what's going on with the back. But if you're having symptoms going down that leg and you're having things like foot drop, where that foot's slapping the ground because you can't control it, or you can't pull your toes up, these are things that are going to be a little bit more concerning to us, because you can have things where you can push the spine against the nerve. So you can see how, if we're always bending forward and doing activities, this material in the disc gets kind of pushed to the back, and you can have issues where it pushes up against the nerve. Now, I don't really worry about that. We can find people that have nerve compression where they're getting some numbness and tingling, but we're able to change the location of where it is, or making it better and worse. Those things we can completely resolve. But when you have enough nerve compression that all of a sudden you're starting to get foot drop, you're starting to get a lot of weakness, or all of a sudden you're noticing your muscles have withered away in parts of your muscles, whether it be your hamstring or something like that. We know there's some pretty serious nerve compression, and these nerves take forever to heal. So if you're having enough compression on those nerves, and if you end up having it where like it's so damaged, it may not heal at all. And these are conditions that we need to do surgery for, because we've got to get the pressure off that nerve immediately. And that's when it's a serious condition. So numbness down the leg, don't really worry about it. But if you're getting pain down the leg and you're getting some foot dropping, that you can't control that leg, that's more serious. If we can't improve that strength immediately, because there's times when we can have people that come in here, we can do things to take pressure off that nerve, and all of a sudden, woo, man, their foot no longer is dropping. They're actually getting strengthening in that foot. That's amazing. But if you also have patients that come in and their symptoms are progressively getting worse in their leg and starting to get weakness, and we can't make changes to that, that's a more serious condition. And we've had patients that have had that happen before, where they had some back pain and they went and played golf, and they came back in and they're like, oh my God, it's gotten worse. And we're working on them and their symptoms are continuing to get worse. And we're not noticing the same patterns that we see with other people where, wow, their conditions are getting better. These patients are actually getting worse. We've had to send them to go and have surgery. We had another client that came in that had back pain and wasn't really sure what she did. And we were working on her. And again, the symptoms were getting worse. No matter what we did, they were getting worse week by week. And I'm like, nope, let's go and get an MRI. Let's check and see what's going on. And so she came back in and had a cyst that was in her spine. I was like, that's interesting. Like, how did you get this cyst? And she goes, I was thinking about it. I fell a couple of months ago on my back. And I'm like, oh, when you fall, these kind of things can happen. And that cyst was so big that it didn't matter what we were going to do. She was going to have surgery to take that off. But this is when you get information from doing a thorough evaluation with MRIs. When things aren't progressing the way they should be, this is when it is important, because you can get both those information, go, yes, this makes sense. We need to go in and further investigate this, and you're going to have surgery. We also have had clients where they have, that sinister thing that's going on where they're getting spinal cord compression. And so if you're getting spinal cord compression, this is also another thing that we have to address quickly. And so how do we know when someone has spinal cord compression? Well, we know because of their symptoms. So if they're getting bowel bladder changes where they're having a hard time, they're just not able to hold their pee and it's just kind of coming out. It's like that's a bad thing. When they're having numbness and tingling in kind of their private parts, that's a bad thing. When they're noticing global weakness in their leg, that's a bad thing. We've had a patient come in and they were filling out their paperwork and they stood up and they started walking and their leg was moving in a weird way. And I'm like, wait, how long has this been going on? And it's like, oh, this is a new thing. I'm like, okay, it's a new thing. And I'm like, since your back pain? Yes, since my back pain. I'm like, oh, we've got to test this. And he had positive signs for spinal cord compression and global weakness and all, bowel bladder changes. I'm like, oh my God, how did a doctor miss this? And we sent him immediately to a surgeon and he did. He had cord compression. And again, when you have compression in a nerve that is so bad or compression in your spinal cord, you don't want to mess with that. Like we've got to get the pressure off that immediately. So those are the big things that we look into where you're going to have some intervention, some surgical intervention in order for this to happen. But literally, this is so infrequent. I mean, in the last 6 years, we probably only sent 4 people to have back surgery in the last 6 years. We've saved many people from having back surgery by coming to this office because we're understanding what's going on and why it's happening. And the big things are, again, numbness, tingling, I don't really worry about it. Pain down the leg, I don't really worry about it. These are things that can be common. Even weakness in the leg when we test you, because we can test which level is giving you issues if you have enough symptoms in the leg. Even weakness, we can get to increase immediately because if we go in and we can take pressure off these nerves in the back, you can almost get immediate strength improvements. You can get pain in the leg or numbness in the leg that starts moving up the leg or starts reducing. And those are really common. So just because you have symptoms in the leg is not something that is concerning to me. It's when you have massive weakness, foot drop, you're having, global weakness, numbness, tingling that's in your private parts. If you're having issues with bowel bladder changes, if we're having issues with walking and controlling that leg, these are things that need to have attention immediately. My name is Stephanie. I'm with Empower Physical Therapy, and we help patients with chronic pain get their life back without having surgery or injection. So if you're liking what you hear, make sure you subscribe to our channel so that you can get great content like this that we provide every single week.